Hi, So we're going to have an introduction about why we would want to practice yoga for pregnancy, for birth, and after, so the postnatal period. So first, looking at what is the purpose of doing yoga for pregnancy. Now, most people, when they think of doing yoga for pregnancy, they think of staying flexible, they think of yoga for back pain, they think of another form of exercise. So instead of doing running or whatever it may be, something that's a bit more gentle, but they're also thinking about yoga as a form of weight management. So yes, we can use yoga for all of those things, but actually yoga in pregnancy goes much, much deeper than that. And it's all about the fact that you are carrying a soul, caring for it for that 9 months, inviting it for the time of conception, carrying that soul and birthing that baby, and all of the imprints that are going to be on that baby from the way that you do things, the way that you're thinking, the environment that you're in. So it's actually a really big thing to think about, the point that if we can raise a child which is going to do something good for the community. So in the way of raising, I don't mean just raising once the baby's born. I mean, if we can try to invite that positive soul, happy soul into the world that is going to do something good for society instead of bringing society down. That is the purpose, and that has been the purpose from the traditional perspective in India for a long, long time. I wouldn't necessarily say it's related to things like yoga asanas, but the philosophy that is there related to being in pregnancy and preparation before pregnancy is all about having that well-balanced soul that is going to help society. So we want to look at making sure there is going to be harmony and peace within and without, as that is all going to be having an effect on mother and baby. So happiness for myself and for all, connecting with everyone, connecting with Mother Nature. So there's a lot of things to think about when we teach pregnancy yoga. So don't think that pregnancy yoga is only about, keeping the body toned and keeping her emotions a little bit balanced. It goes so much deeper than that. And that's why we have this very long pre and postnatal teacher training, so that you can think of all the other aspects of yoga which can have a really nice positive effect. So looking at why you might have students coming to yoga. So first, to keep toned and healthy weight management, as I mentioned in the last slide. Definitely a lot of people are going to do yoga as an alternative to other forms of exercise, and that is fine. It can definitely do that. Not only with the movements that can keep you toned and strong, but also with the mental aspect. So people understand that they can eat in a balanced way, not overdoing it, not underdoing it either. So that is definitely one of the reasons, but they may come for that reason, but then they get other benefits. Various health problems. So it might be that they're feeling very anxious. It might be that they're not able to sleep. It might be that they're having pain in different parts of their body, so they think that yoga would be helpful for them. Stress and anxiety, definitely. Everyone is having some kind of stresses in their life, but especially during pregnancy, that can be a little bit more strong, especially for certain types of people. Someone who has more of a tendency towards getting stressed or getting anxious, this is going to be heightened in pregnancy. And we all know how helpful yoga is for management of stress and for the mental health. Then because a doctor has recommended them to do yoga, which is really nice that it is recommended these days. So it's often recommended over different forms of exercise, or it can be also recommendations because of stress and anxiety. Yoga is becoming well known to be helpful for so many problems these days. Because it's popular. And it's funny, but it's true, because if one celebrity is doing yoga, then other people want to do it and they think, oh no, that's the thing I should be doing when I'm pregnant. And there, looking at the next point, celebrities do yoga, which is true. Okay, there's lots of different types of popularized yoga these days, but a lot of celebrities are doing yoga, which is impacting all these pregnant ladies and making them want to come. Because of recommendations from friends or family, so especially other women who have gone through pregnancy and recommended yoga, a lot of women will come to yoga for that. Remembering many women actually come to yoga when they're pregnant. So they might have never had any experience before, but they become pregnant and they think, oh, now's the time that I should start yoga. To meet other pregnant women. This is also pretty common because not everyone knows another woman who is pregnant at the same time as them. Now, society is changing a lot, so people are having pregnancies at all different ages. So it might be that one lady, she's pregnant, but none of her friends have got pregnant yet, or all of her friends have already been pregnant, and now is her time. So it's a really helpful way for women to meet other women, to feel connected, to realize that they're going through similar things to them. So it's a really nice social aspect to their life. To learn how to practice at home, this is also important because many people might have practiced yoga before, but they don't know how they have to change things now they're pregnant. So they may come to a class to learn all of that. And it's important for us to teach them because most of the time we're not going to be able to give them a class every day. It'll just be once a week, or if we're lucky, twice a week, we might have pregnancy yoga. So ideally they should be practicing every day to get the benefits. So if you're teaching in a really good way, then you're going to be teaching them what kind of things they can be doing at home. You might give them little lists of things, little handouts, and it will make them feel confident, and also making sure that they're doing it safely from their home. And of course, for a healthy baby, because that is also the main priority here. We want a pregnant lady to be happy and healthy, and also baby. So now let's look at the benefits of yoga before conception. So here I was talking about many women coming to yoga when they're pregnant, but also there's many women who do yoga beforehand. And of course, that's the best thing if they can be doing it before. And many of your students may come to you and say, look, I'm thinking about getting pregnant. So what kind of practices should I do now to make my body healthy and strong and ready? So yoga, of course, has a lot of benefits here. It prepares the woman physically, emotionally, and spiritually for conception. And here, don't just think of the woman, also think of the man, because ideally, both the woman and the man are preparing for this conception, because both of them are going to be having an impact on their baby. So both of them should be working on themselves, making themselves strong, healthy, and well balanced. So creating a positive environment for a baby, promoting physical and mental health, removing or overcoming barriers and fears that they might have in preparation for a child. This can be the woman, but also the man. So for example, many women I've met have been so worried about childbirth that they haven't been able to even think about getting pregnant because they're so scared about it. So that might be a fear that they need to work on. Sometimes it can be that there is another problem there. It can be a problem between the couple, their relationship. One of them might be ready to commit, the other's not ready to commit. So some of these things also need to come up to the surface, and they need to be worked on. It might be fears of bringing a child into this world that's quite unstable. So there's lots of different things that we need to look at. So before conception is really a time for both the woman and the man to work on themselves, sort out their fears, try to get rid of some of their issues and suppressions and problems that they might be having before conception. Of course, we've got things like increasing pranic level, vitality, opening energy blockages, then helping the woman and man to develop spiritually so that they'll be ready to bring a baby into the world. Because it's not just about conceiving, it's also about everything that happens afterwards and for the whole life. So now looking at the benefits for pregnancy. So if we look at on the physical side, it's going to be strengthening the abdominal muscles, which is supporting the uterus and the baby, the growth of the baby. Those abdominal muscles also need to be strong to help with birth, labor. Then strengthening of the spine and all the muscles of the back. And this is important again for holding the baby because the core is going all the way around, and also to make sure that the posture stays good, and also to prevent things like back pain. Then improvement of posture to help correct any postural defects that are coming with pregnancy. So, if they stick their bottom out and push their belly forward, if they're hunching, all that kind of stuff can be looked at during pregnancy yoga. And they might not be very aware of that until someone tells them. Then strengthening the pelvic floor muscles. Okay, so we need to learn how to have our pelvic floor strong, but also flexible. So both things are essential. We need to be able to tighten, but we also need to be able to relax. So, of course, it's important to have those strong muscles to make sure that we don't have any problems of incontinence, but also for those muscles to have that flexibility at the time of birth. Then we want to be able to strengthen and stabilize all those muscles, tone the muscles used for birth, and improve the oxygen levels for mother and baby. Again, continuing with the physical side, so helping women gain more control over their respiratory system. So this is definitely useful in labor, but also during the time of pregnancy. Removal of metabolic waste to improve fitness, blood circulation, help the heart, balance the blood pressure. So the blood pressure can become very elevated, but it can also go very low. Improving immunity, prevention of back pain, to promote a more smooth and stress-free delivery, and we'll talk a lot more about that. Prevention of fluid retention and also relief, so edema, and prevention of leg cramps, varicose veins, constipation. So not every woman is going to have all that kind of stuff happening with her. Some women are very, very healthy for their whole pregnancy, and other women have pretty much everything you can think of. But some things are very common, and yoga can definitely help to prevent a lot of problems and also relieve a lot of problems. Then increasing energy levels, calming the nervous system, creating space. So we want space in that pelvic region, and we also want space in the chest. Promoting a natural and healthy birth without intervention and drugs, to help overcome morning sickness, keep the weight under control, and improving balance, stability, and coordination. This is an interesting one because there is a tendency for many women to kind of lack coordination, find difficulty in balancing, and this is because their center of gravity has changed and their body is changing really quite fast. But with yoga practice, if she's doing it from the beginning, then she generally won't have problems of balance, and she'll still stay very well coordinated and with good body awareness. So even into those last couple of months of pregnancy, she'll still be able to do many types of balancing asanas very, very comfortably. Then prevention of things like prolapse, hemorrhoids, and helping with pain during the time of. So looking at the benefits on an emotional side, so removal of the fear, anxiety, conflicts, tension and stress. So as I already mentioned, the fear of childbirth can be there, the fear of bringing a child into this world, which can not be a very stable world. And there's lots of other fears that can come up for different women. Sometimes it might be fears that you never even thought of. I've known women who became pregnant and the first thing they were worrying about is where their child was going to go to school, which is kind of funny when it's just the beginning of pregnancy. But those kind of things can come up. So whatever worries they might be having, that's going to come up for them, and yoga will definitely help. As I mentioned, anxiety, that, it's very easy to become anxious over things in pregnancy, especially because of access to so much information. We've got Google. Any problem that she might be having, she just Googles it, and then it comes up with all these issues that might be wrong with her or baby. So there's lots of things that she could get anxious about if she chooses to. So it's important to try to keep the mind calm and stable. Of course, different things are going to be coming up. You can't take all the stress away from one's life. We just need to learn how to be able to deal with it. So that's a really important technique of stress management. To learn how to relax is also really important. And to have the stable emotions as much as possible. Of course, emotions are going to be up and down. That's also due to the hormones, but to some extent we can control and manage it. Improving mental peace and calmness. Now, I talked already about relaxation. Teaching her how to relax is going to be one of the best techniques to help her, not only in pregnancy, but also when babies come. So in her life as a whole, because once she has her baby or babies, there's going to be a lot of things that can still create stress for her. So she needs to be able to deal with that. Learning to control the mind and have that aspect of witness. So to be able to take a step back and observe the mind is a really helpful technique. Then to be able to create that bond and connection between the mother and child is really, really important. Now, there's so many studies that have shown the importance of connection between the mother and child, which begins when the baby's in the womb. It doesn't start when the baby comes out. And if that connection hasn't started while she's pregnant, then there's much higher chance that she may have postnatal depression, and all sorts of problems can occur, even things like breastfeeding and all sorts of stuff. So it's really important that that connection is there. I remember I was teaching in Nasik to pregnant ladies, and I had one lady and she came to me in about her 5th month, and she said to me, "Oh, I didn't want this child," because she became pregnant because of pressures of society that, that's the thing to do. You should have your baby, get married, you have your baby, that traditional way. And so she wasn't ready to be pregnant, but she was. And so she said, "I didn't want this child. I've been saying, that she hoped it would, she would have a miscarriage, all this kind of stuff." She was saying horrible things to the baby. And then at some point, the things in her mind must have changed. Like, she started thinking about the baby. Maybe it was the time, I feel it was the time when the baby started moving inside her, that she could understand the baby there and really start to feel that connection. That was when she came to yoga, and she said, "What am I going to do to fix this? Like, I feel so bad now because of all the things I've been saying, and I want to feel connected to my baby now. I want my baby." So we did a lot of meditation. We did like a connection, baby connection meditations, all this kind of stuff, putting her hands on her belly, giving massage to her belly, all these things. And everything ended up really good. She had a really good labor and birth, and she was really connected to her baby when it came out. So it is really important to feel that, because they say that if a baby doesn't feel connected, even at the time of when it's born, sometimes it doesn't want to come out, but also sometimes the baby doesn't even want to have breast milk because it doesn't want to have that thing from that mother. It feels that disconnection. So it is really important that they're both connected together. And as I've mentioned, there are many, many studies now that are talking on the importance of this, and there's just more and more research coming up all the time. Then to change the quality of the thoughts. So as I mentioned before, like if a mother is very stressed, that's going to release stress hormones, and they're also going to circulate to baby. And if she's feeling anxious, definitely baby feels that anxiety. If she's feeling depressed, baby feels that. So it's important to try to have a positive state of mind as much as possible. Of course, it's not always possible, and she shouldn't feel guilty if she does have negative emotions coming up. But definitely we can have a more positive outlook on life. We can deal with things in a much more positive way. And that kind of thing is a setup for life, not just pregnancy. Then helping to balance and stabilize the emotions which can be unstable due to hormones, to create the mental strength needed to cope with any problems during pregnancy and birth. I have a lot of women that say, oh, I just can't deal with it. I don't think I can deal with pregnancy. I can't deal with birth. I'm not strong enough. And I'm like, yes, you are. We all have that strength inside us, but we just need to be able to capture that and to build that faith in ourselves that we can get through pregnancy. We can carry a child. We can give birth in a powerful manner. So it's really important to build that in our ladies, because from a lot of the time there's pressures on society, and women have been put down that they are not strong, that they are weak, and that they can't deal with things, and they can't deal with birth, and they need this and they need that, when they have everything, but they need to access it. Then creating positive feelings of love, compassion, appreciation, gratitude, and peace. Definitely, this is really, really important so that she can value and respect all that she's doing in growing this child. And there's more. So helping one to find the balance in life, with the struggles, obstacles, and so on that can come up during this time, pregnancy related or not. For a woman who becomes pregnant, there's lots of things that she can be thinking about. For a start, was it a planned pregnancy? Was it an accidental pregnancy? That can also have an impact. She may be thinking about the relationship she has with the father. She can be thinking about her work situation. Is she going to be able to continue working? Does she have to stop? Will she get any maternity leave? All that kind of thing. She might be thinking about where she's living. Is it suitable? There's so many things that can be coming up for her. So it's important to have that stability and to be able to cope with whatever she has to face. Then creating trust and faith in one's body, like I've been talking about. Empowering a woman is also important, so that she has that strength, as I've mentioned before, that strength and faith in her body. Encouraging women to honor themselves and enjoy the special time of pregnancy. A lot of the time you hear women complaining about pregnancy. It's always more that you hear complaining than how wonderful it was, because there is just a tendency that, complaints are there more. But of course, many women go through pregnancy really, really positive. There's so many beautiful things in pregnancy, and many women who have gone through pregnancy love being pregnant and would do it again. And many have. And obviously, if it was such a problem, women would only have one child. So it is important that they do enjoy the time of pregnancy, and sometimes it can be hard. If there's lots of things they're facing, if they're feeling very sick, it can be really difficult. So it's important to show her all the positive things so that she can be happy about that chance to grow that baby inside. Because not all women can do it. And certainly, men can't do it at all. So they're very lucky. She's very lucky to even have that chance to have a pregnancy. Then improving concentration and clearness, this baby brain that can happen in pregnancy and, of course, when babies come out. Then creating yogic awareness so a woman can birth in a conscious and powerful manner. And we'll talk more about that when we talk on labour. So also looking at the benefits postnatally. So toning of the abdominal muscles, bringing everything back into shape, bringing the uterus back into its pre-pregnancy shape and position. That, of course, is definitely important, strengthening the pelvic floor. But prevention of postnatal depression is really important. Balancing of the emotions is so important. In fact, mental health is most important during that postnatal time because it is hard. For almost all women, they're going to find it difficult. Then they're hardly sleeping, they're feeding baby all the time. Again, with feeding baby, there can be lots of problems that come up with breastfeeding. She might have trauma related to the birth. Lots of stuff can be occurring. If the child is having a lot of problems, again, more stress is added on. A lot of women don't have much support network. So it's really important that they are feeling supported, and you can give them techniques that will help to make them feel calm and happy and important. Improving overall well-being, definitely, and promoting a fast recovery. So all of these things are important in the postnatal period, but first priority should be mental health, and then slowly strengthening the physical body. It shouldn't be about losing weight. I've known of some women 2 weeks after giving birth, they hit the gym, they start doing all these strong forms of yoga because they want to lose weight, because they have this idea that, I need to get rid of the belly, my belly needs to be flat, I need to look the same as I was before pregnancy. But actually it takes time because you've had 9 months to carry this baby and the body's been changing that whole 9 months. It's going to take time for the body to come back into its normal shape, and it's not the priority. The priority is to care for oneself and care for baby and make sure that one is healthy for this. So looking at benefits for the baby, so that is also, of course, definitely important. Having a more peaceful atmosphere and a positive energy, making the baby feel secure and loved, helping in the spiritual development of the baby. So there's many aspects to that, which starts before conception. Improving circulation, getting rid of waste, increasing nutrition, all that, of course, is important. And also promoting a peaceful delivery for the baby, because there's also a lot of research. There's been research coming out since the 80s about the effect of birth, not only on the mother, but also on the baby. So it should be as peaceful as possible, because a lot of mothers can have a post-traumatic stress disorder because of it, but babies can also have it, or other things that can come later on in life. So what kind of things to practice? Well, asana is very well known. There's lots of different types of asanas, there's lots of different types of yogic movements that we can be doing, many types of pranayama we can practice, some cleansing techniques, not all cleansing techniques. Meditation, definitely. Relaxation, visualization, definitely. Yogic philosophy is really, really helpful to have a more positive state of mind. And of course, mantras. So all these things can be done to have a really holistic yoga practice. And how long can they practice for? That's the other question that people often ask. So actually, there's no time where you have to stop practicing yoga in pregnancy. Many women will practice before they become pregnant. They'll practice for the whole 9 months. They'll practice when they're going into labor. They'll practice while they're in labor. They may even give birth in a yoga pose, and they can immediately practice afterwards. What they practice will vary. You're not going to go and have a baby and go and do 20 sun salutations, but you can do yoga nidra, you can do pranayama, you can do meditation. So if you look at it from a perspective of a whole yogic lifestyle, there's always something that can be done. So never think that there is a time that one has to stop. following guidelines, remembering limitations accordingly, and adapting. So adapting to where one's at, the situation, and how they're feeling. Carry on.